Welcome to this first webinar of Frugal for Health in collaboration with the Global Health Next Generation Network. We are very happy to have you here to talk about frugality in healthcare. Today we have 5 panelists that will be sharing their stories with us, and Manu from Global Health Next Generation Network and myself from Frugal for Health. We will be moderating the session. So we will have time to present each one of the people that will be speaking today. And most of the session will be in English, but some of the part will be in Spanish because some of our panelists speak fluent Spanish, and also our people that is connected in the webinar also is fluent in Spanish. So we will move to the webinar. So thank you very much for being here, and we start with the presentation. So the agenda of today will start with the presentations of each one of the panelists. We will ask them for their stories, but then after this one presentation of each one, we will have short individual one-to-one questions and answers. These will be directly, these will be sent the questions from us, but if anyone from the public wants to have any specific question to the panelists, please share it in the chat, and my colleague Manu will be collecting these questions and we will ask them in the end of the session. This is pretend to be for 1 hour or 1 hour and 10 minutes, so we will try to manage in that time. After the questions directly to the panelists, we will have a group discussion about frugality in healthcare, what it means that frugal innovation in healthcare. And final, we will do the closing with questions from the attendants and final closing of the event. So thank you very much. And we start with the presentations. So Manu is helping me with the moderation. Manu, he is a doctor born and raised in India, but he has moved all around the globe doing global health in Russia, UK, and now he's in Barcelona. And he will be one of the moderators with me. Myself, I'm Edu Soler. I'm the coordinator of Frugal for Health, and I've been working for long in technology innovation in the healthcare system in Spain. So thank you very much, Manu, for your participation. And let's start with the panelists. What do you think, Manu? Let's start?
Let's go.
Let's go.
Yeah.
Let's go.
Yeah.
Thank you, Manu. So today we have 5 people here that are coming from different countries of Africa. We have Kenya, Uganda, Senegal, and also we have Mahib from Nepal. So very a global ecosystem that is connected today. And we have divided them in 2 groups. The first group are entrepreneurs that are working in service design, and we will hear their stories. And the second group is the group that are working in medical devices, in product designs, okay? So we will move one-to-one to listen their stories and to understand how they are developing their projects in healthcare, and also after we will have them about the frugal discussion. We will ask you to present yourself first. Second, present your project. And third, if you have an action call to the audience, this is your time to ask whatever to the audience, okay? So let's move to the first, Faith Muaisia from Kenya, the coordinator of Border Girls. Faith, you want to present yourself on what you are doing in the Border Girls very, very shortly?
Sure. Hello, everyone. My name is Faith Muaisia. I work as the project coordinator for the Border Girls program. Border Girls is a project by Matibabu Foundation. Matibabu Foundation is based in Siaya County here in Kenya. Border Girls are women who we train how to ride motorcycles, which is the most common means of transport here. We train them on 15 other certifications, including entrepreneurship and first aid, and they in turn help bridge the transport gap between the community and our hospital that is based at Matibabu Foundation. They work in increasing access to women's health, their education, as well as just improving their livelihoods.
Perfect. Do you have any action call that you want to share with the audience?
Sure. The Border Girls are usually giving what we call free rides to any woman for delivery, for antenatal clinics, and because the rides are free to the members of the community, but the project in one way or another pays the Border Girls. So if you want to become, part of this journey, visit our website at bordergirls.org. Then you can find a way to contribute.
Okay, thank you very much, Faith, for being here. Yes, let's move to next one. Vamos con Alfa Yaya. Alfa Yaya es de Senegal. es el coordinador de los proyectos sanitarios de esta organización, Alpha Yakar África, la organización que lidera en la parte sanitaria, y trabajan mucho con la formación de sanitarios de zonas rurales, zonas donde cuesta mucho que los sanitarios vayan para trabajar en estas zonas, y ellos lo consiguen de una forma muy, muy creativa. Alfa, ¿nos puedes un poco hablar de ti, quién eres y un poco qué habéis hecho en esta zona rural del Senegal?
Hola, muy buenas todos. Sí, y es un placer participar en esta reunión. Soy Alfa Yalo y soy enfermero de estado. Estoy trabajando aquí en Senegal como enfermero en un hospital regional, sí, en una planta de cirugía.
Ujú,
Pero bien. Y Yacar África es una ONG humanitaria que está aquí en Senegal, que trabaja mucho en la zona sur del Senegal, que se llama Casamance y el Pays Basari. Es la zona en el sur del Senegal. Sí, es una ONG que ayuda mucho a la población senegalesa y que forma también estudiantes y en muchas cosas, como en la salud, en electricidad y en las cosas que pueden ayudar un poco a la población rural
ujú,
que necesita mucho ayuda. Sí, y yo estoy coordinando un poco la parte de salud de esta ONG. Sabes que la ONG trabaja muchas cosas, pero por la parte de salud estoy coordinando un poco. Sí,
ujú,
y el presidente es un español y tenemos también un coordinador nacional que se llama Dembayé
ujú,
y sí, que está aquí también trabajando, hace muchas cosas. Pero bien, y estudio en Dakar y que la formación que este ONG que se llama Dakar África ha pagado mi formación durante 3 años en Dakar, que es la capital senegalesa.
ujú,
Y después de esto, estaba en España para hacer prácticas también en la misma formación, la enfermería, y vuelvo ahora en mi pueblo y en mi ciudad para ayudar a mis gentes. Sí,
ujú.
eso es. Y creo que después podemos hablar más de esto.
Muy bien,
Sí.
muchas gracias, Alfa. Y
Sí.
por ayudar un poco a completar la parte más frugal, ¿no?, del proyecto, cuando estuvimos allí y lo pudimos entender, era que convertían estos sanitarios no solo en trabajadores rurales, sino
Sí.
que se convertían en agentes del territorio, ¿no? Se convierten en voluntarios de las zonas
Sí.
rurales y un sanitario lo multiplican en 15, ¿no? En lo que hacen 15 personas, porque los están entrenando para muchas cosas diferentes. Hablaremos más de esto cuando tengamos la
Ah,
ocasión.
sí.
Y vamos a cambiar al inglés. We get back to English to talk with Prosper. Prosper is from Uganda. He's the CEO of MScan Uganda, a medical device company. So, Prosper, can you tell us a little bit about you very briefly? What do you do in MScan Uganda? And if you have any call to action for our people before we start with the debate?
Oh, thank you, Eduardo, for putting this together. Yes, as mentioned, I am a co-founder and co-CEO at MScan Uganda. Those who have not heard about MScan Uganda, we develop and deploy portable ultrasound machines. As you can see, on the presentation, what the midwife is holding. And these work with a laptop or, tablet or phone to deliver, antenatal ultrasound. Anywhere. And for us, we've used it in Uganda. We have 16 deployments in public health facilities, but we're also pioneering a lease model with private clinics to be able to sustain the incomes that will help, to keep the lights on at MScan. Our impact as of today is over 12,600 mothers that we've reached out to, that have never afforded or accessed an antenatal ultrasound. Yes, in process, we've actually detected about 1,500, fetal maternal complications, and these mothers have been referred for the care that they need. So at the heart of what we do is extending, life-saving antenatal diagnostics like ultrasound to those who need it. I would implore all of us to join the movement to ensure that no mother, dies while giving back to life. I know, the bulk of the problem is in Africa, but places like Asia also have this, this scourge. And yes, let's join forces to make, maternal mortality a thing of the past.
Thank you, Prosper, for your explication. And I would like to add that when we had the time to be in Uganda, we were able to meet how they are using this in refugees camps, places that are very, very remote, that where the roads are super, super hard to reach. And this is why you see this in this kind of settlement, because this is a refugee settlement where this ultrasound scan is being used in a very, very easy way. Thank you very much, Prosper, for being here and for your explanation. We move to Mahib. Mahib, he's from Nepal and he's the coordinator of the baby warmer, this device that you see in the picture. And Mahib, I think you are better to explain who you are, what do you do in this National Innovation Center, and what is the baby warmer that you have developed.
Yeah, sure. Thank you, Edu. Thank you, everyone, for joining in. My name is Mahip, and I'm an electronics engineer. I work at the National Innovation Center. It's been 5 years since I've been working in this organization. Very briefly speaking about our organization, it is a non-profit entity which promotes innovators to turn their ideas into working products. So one such example is the Nano Nani, which is the baby warmer that you can see on the right. So we started out with a simple problem statement of neonatal hypothermia, which was causing a lot of mortalities and morbidities in across Nepal. Although these kinds of radiant warmers are pre-existing, we found out that they were not modular, so you couldn't take them to the most remote areas. It was hard to maintain them, and it was difficult for the end users to utilize them fully. So we decided to build one locally using the local resources that we could get, and it's been 5 years that we have been working in this project. So far, we have over 110 installations across Nepal, and at this point of time, we are looking forward to scale this production and turn it into a certain profit-making entity within Nepal. So thank you so much.
Yes, congratulations, Mahib. It's an amazing project. I also had the chance to meet this National Innovation Center in Kathmandu, and I should recommend any innovator in the world that goes for tourists to Nepal that save at least one day to go to this innovation center because it's super, super amazing the work that they are doing this with the resources, with little resources, the impact that they are doing is crazy. Thank you. We move to the last of our panelists is Ronald Amodoy. He is a researcher of the project MRI Uganda. This project has not been yet launched in the market, but if they launch very soon, it will revolutionize the MRI industry because they are developing this tool for at least I think it's 10% of the cost of the current MRI that are in the market. So Ronald, how are you? Can you explain about you, who you are, and what do you do in MRI Uganda?
Yes, Edu, thank you very much. I'm really glad to be here. Thank you for the opportunity and the venture. Happy to meet everyone. So my name is Ronald Amadoy, and I'm a technical research assistant with the Low-Field MRI project. So the challenge that we have in most of the imaging modalities that are non-ionizing like PETG and things like that, they are really very expensive. And for low middle income countries, it's really very hard for most of them to access such over 1 million or 2 million US dollar imaging modalities. And you find that there are very few. So for example, MRI scanners, depending on the field strength, we have in Uganda over a population of over 15 million, only about 10 MRI scanners. And you find that the limiting factor is things like the cost of the scanners, the maintenance protocols, the personnel that are needed, the technology, and all those kinds of things. So we ventured into an idea of how can we be able to achieve non-ionizing imaging, that is low-field MRI technology, but at a low field, which is able mainly to target a specific patient population of children that have infant hydrocephalus. So we managed to build a 48 millitesla system in Uganda, and our target patient population is mainly children with hydrocephalus, but also we're extending the imaging to wrists, to knees, to extremities of the body. And all this comes at really a very cheap price, whereby a patient is only able to pay $10 per scan instead of over $300. So you find that these services are extended to the population. More to that, you find that most of the MRIs are stationary. That means you have to go to the station to access the MRI, but we are going into a portable system whereby we're able to reach out now to the population, go to the communities, do the imaging, and then give them the results. And then so we're delivering the service directly to the patient and to the consumer and at a very reasonable price. Yes, thank you so much.
Okay, thank you, Ronald. Thank you for your explanation. I think this project is amazing. I had also the chance to be in this lab that you see in the picture where they are creating this MRI. And I would say that also the lab is super advanced. I mean, is they would like to have more, but is in a very big and good university in Mbarara in the south of Uganda, and amazing team that they are developing this low-cost MRI for many pathologies like hydrocephalia, what we see in the picture. Okay, so we know you now. We know you. What do you do? Each one of you have had the time to present your project. So we have seen how Faith is doing the motorbike woman drivers. Alpha is doing the healthcare training for remote rural places in Senegal. Prosper has tell us about this ultrasound low-cost device that they are deploying in many places of Uganda. Also, Mahib, this project, the baby warmer for warming up the babies where they are born, and Ronald, the MRI for different pathologies that is also really affordable MRI. So thank you very much for explaining your project, and we move a little bit to the conversation part. And for the conversation part, we have one question for each one of you, but it will be my friend Manu from the Global Next Generation Health Network that will be running this part also with my help. So Manu, I give you the floor for that.
Yeah. So I think you can go to the next slide.
Yes.
Yeah, first of all, thank you so much everyone for joining. I mean, it's a pleasure, and seeing all these innovations. I mean, it's something very huge. And yeah, so my question, I think it's for Prosper. I think so. Why you decided to create a new device, like instead of you couldn't like not buy the current ones or importing from other countries. So what do you feel like regarding? I think yeah, that's my question for now. Yeah.
Yes, yes. So, well, we started our prototyping from Uganda. The background story is we started with an idea that was trying to eat up this mountain of maternal mortality. So went to one of the rural I would say centers in Uganda, in central Uganda in particular, and we had conversations with pregnant mothers, and the third largest district in Uganda had only 3 ultrasound machines in their public health facilities. And it's from these conversations, asking them how much they could afford to do a scan for, understanding they had to travel over maybe 20, 30 kilometers from their homes to actually access these machines. That sort of gave us the impetus to actually develop with them. So our product has, been built with a human-centered design. And that's, I think, one element that has set us apart from all the other competitors that we have in the space of mobile ultrasound. Of initial prototype cost about $10,000, but we had to, move from that to mass production because the need was across Uganda, and we shifted the manufacturing from Uganda to an original equipment manufacturer. But this was for the mass, production. But in process, we also protected ourselves. So we have IP that is registered in Uganda and also the Africa Regional Intellectual Property Organization in Southern Africa. So for us, we have been intentional with how we move, how we design, and how we deliver our product. I would say, I think where we are, we pretty much content with the impact that we've done. When we started off in Uganda, the numbers of mothers that were dying, we're losing about 380 something, 83 mothers per thousand live births due to complications of pregnancy and childbirth. Now the number is down to about 189 per thousand live births. We're not saying that we are fully responsible for that, but we are been part of the process. And for us, it gives us joy and the drive to keep going, and also getting on other stakeholders to make sure that we're able to serve mothers. But in particular, Eduardo had mentioned that we are present in refugee settlements.
Yeah, that's
These
what I
are
wanted to
spaces,
ask you.
yeah, these are spaces that we have been, intentional about as well.
Mhm.
And he visited one of the refugee camps in northern Uganda, which was Palabeg. But also, we are also present in the biggest one in Uganda, which borders with South Sudan, in the west of the Nile,
Oh.
which is called Bidi. So these are spaces where mothers literally don't have even the money to
So
pay.
are you actually collaborating with the UNHCR?
So here locally, UNHCR subgrants health work to partners, and here is the International Rescue Committee. I don't know if you've heard of IRC.
Oh
So they're
yeah,
the people we
the
partner
Red
with,
Cross. Yeah.
and also United Nations Population Fund, which is UNFPA Uganda. So those are partners that we have
Oh wow.
long-term working, relationships, agreements, and support from. And we're glad, even from our inception, that these are partners who have enabled us to actually reach some of these spaces where the impact is felt.
Yeah, I mean it's really interesting. I mean, in the current geographical conflict situations, like all around the world, this is something really helpful. Like I used to think because uh, thinking about I'm not specifying any country, but then in this scenario, especially a device like this, could help like millions of mothers to to do the scanning, and yeah, that's something great. Yeah,
Thank you, Dr. Manu. And
yeah,
I would say if there are any big pockets listening in, we want to scale to the rest of the refugee camps and also across the region. So that is Kenya. So we already sell in Kenya for commercial,
all right.
commercialization. We sell in Kenya. We've sold in DRC. We've sold even in Namibia. So we are commercially, it's what we are moving towards because, uh, I mean, we all know there's been a global cut in global health funding, and as a response, we're trying to buttress our commercialization. So we are open to receiving support to scale to people who need it in terms of
Sorry to
scaling.
cut. Sorry to cut, but we have to move to the other
Oh yeah, yeah.
speakers of product design. So I would like to listen also, I don't know, from Ronald or Mahib, the same question.
That
So
yeah. What about Mahib like?
yeah.
Yeah, sure. So the reason why we decided to make the device itself in Nepal, and not kind of buy and resell them like the other people were doing, was the first thing was the affordability. There were devices in the market, but the ones that were cheap were not that of good quality, and the ones that were expensive, the birthing centers couldn't really afford them. So we kind of found a midway between quality and price. So at this particular price segment that we have built the baby warmer at, we think we have been providing a great value to the customers. So the other thing that we also kind of figured out during the initial process that was the devices would break down often, and the spares or any kind of repair related activities could not happen because there was a large gap between the manufacturers and the end users. They would ideally have a year of contract with them for repair, but we also found that it was very hard to get things repaired in the rural parts of Nepal. So we use a lot of the electronics components, almost all of the electronics component which are found locally. So in Kathmandu, in the major cities, you can find those replacement components, and the system itself is not a very complicated one. So I think repairability is also one thing that made us decide to actually build it in Nepal. We also found out that the technical literacy for the end users was not that high, so they were not being able to use the device throughout the year. And the changes in the overall healthcare workers within the facility would change in 6 months, eight months. So the ones who initially got a training would not be able to use the device later on. So every 6 months, we support the end users through virtual training sessions, because physically it might not be practical in all of the places. So we reach out to them asking how well they are using the device. Has there been a change in the rosters, in the force there? And we kind of supplement the training aspects of that. So I think these are the reasons that kind of helped us decide on making the baby warmer within Nepal.
Oh well, that's great. And yeah, now we'll move to Ronald. And yeah, about the Uganda MRI. What made you initiate this the project, and
Thank you, Dr. Manu. I think I'll just try to be brief as possible. So, one is the cost of the MRI, and most MRI systems are very expensive, costing over thousands of dollars because of the equipment and the associated electronics, maintenance, consumables, personnel that are required, and all that kind of stuff. So besides, since we are aware of the principles in MRI, we are aware of what we need to do to obtain the image. Why don't we try and break down and get this price lower? So the first idea is how can we cut the price of the existing MRI systems that are really very expensive and get something really, really cheap and affordable that a normal consumer can be able to access. And then secondly, you find that the available MRI systems are stationary. That means the patient has to travel to the health center, you know. So one, but how about we travel to the patient? Can we reach out to the community instead of the community reaching out to us? So we moved from a stationary system to a portable system that can be rolled on wheels. Secondly, we look at on our system where there are a lot of components that are actually cut off that enables the operators, the radiographers, and all the medical personnel associated with imaging that are not available. For example, the conventional MRI systems, we have cooling systems, superconducting magnets, and all that kind of stuff. So that really makes the system bulky, expensive, and very hard to maintain. If a system got any faulty issues, we would have to contact maybe Siemens, and the whole process would take over a period of months. But let's get something that is customized to our population that we know, and then we can easily run over the problems as fast as possible. So then you also find that the existing imaging modalities that are available are not suitable for some of the patients, especially for infant hydrocephalus. When you look at exposing a baby as a young child to ionizing radiation, it's really not that's a big threat. And then the PETs and the nuclear imaging modalities are really not available completely. So uh, in short, one is cutting the cost. Two is getting something that is portable. Three is transferring the technology to the community, and then that is community reach out, and then how can we make a system that's really simple but achieving the same quality of the service as the others. So just in a nutshell.
Thank you,
All
Ronald.
right, yeah.
Thank you, Manu, for this. It has been super nice to see these three engineering
Oh,
projects.
yes, yes.
Yes, congratulations all of you for your projects. I want to ask this last question to one of our colleagues in Spanish, to Alfa Yayo from Senegal. Alfa están acercando el conocimiento sanitario, están formando sanitarios en la zona rural de Senegal, pero estos sanitarios son algo más que sanitarios, son al final agentes de territorio y Alfa Yaya es uno de ellos, que participan en muchos proyectos mediante la ONG que les financia esta formación. Entonces, Alfa, un poco me gustaría que nos explicaras por qué, más allá de formar sanitarios, sois un poco agentes de muchos proyectos, ¿no? de esta organización de Yacar África. ¿Por qué usáis los profesionales sanitarios más allá de simplemente ser sanitarios como tú, ¿no? Que eres enfermero y aparte pues estás coordinando muchos otros proyectos?
Venga, gracias, Edu. Y como le voy a decir, es que todo empezó como cuando ya cada África ha tenido tienen una mentalidad que cuando forman prácticamente los jóvenes del pueblo o de la zona, que ellos no es un obligatorio, pero que ellos si quieren que se dedica a hacer como voluntarios, a ayudar también a la
Ujú,
ONG más cosas en la zona.
ujú,
Sí, por ejemplo, es que la ONG ha formado más de 50 estudiantes.
ujú,
Es que yo me dedico solo a ayudar a la ONG y no espero nada que la ONG me paga un precio para hacer esto.
ujú.
Yo lo estoy haciendo solo para la población.
Ujú. Sí, sí,
Sí,
se convierten en como agentes sociales, ¿no? Los que se llamarían
eso.
como
Sí,
convertir a los trabajadores sanitarios en agentes sociales
eso
gracias
es.
a formarles, ¿no? En esta formación sanitaria. Muy
Sí.
bien, so we switch back to English. We had these first one-to-one questions to most of our panelists, and now I would like to switch to the one of the last parts of the conversation is the open discussion about frugal innovation. And let me share the presentation. Sorry for that. Okay. So let's move to the last part of the webinar. That it is not just the last part, because the last part is, if you have any questions, please share it in the chat, and my colleague Manu is collecting all the questions, and this is the last part of the webinar. But right now we want to share, we want to listen to the opinions of our panelists about what it means frugal innovation in healthcare for them. Frugal innovation is quite unknown word in the global north, like in Spain, where I'm based. Not many people know frugality, what it means. But I would say that there are many organizations worldwide, even in the north, in the south, in the east, and the west, that are working this concept. Okay, we have people in United States, we have people in Latin America, we have people in India, we have people in Nepal, we have people in Holland, we have people in England that is talking so much about this word, about how to do more with less. In Spain, we have the Maker Fair in Galicia, that are they will be the ones who are running more this concept of doing yourself, or do it with the resources you have. Try to make the best impact of what you have, and but still is an immature work in many contexts. But there are books, there are many books that has been written down in terms of frugality. So what I'm trying to say, that the concept is there, is just how now we land it in the society. And I would recommend these three books, whoever is interested to deep on in this concept of frugality in healthcare. And one of the learnings is that it's not the same talking about frugal innovation in the north or in the south, or in the in the global north or in the global south. But today we have here the panelists from different countries that we want to ask this question: what means frugal innovation in healthcare? And we don't have any order. So is it any one of you wondering to answer what it means frugal innovation in healthcare from their perspective? So I don't know, whoever is willing to participate.
I will, well,
Okay,
I'll
thank you,
go
Prosper. Yeah,
first on
you go,
this.
Prosper.
Yeah, I think what you mentioned, making more with less, I think it's a principle that I know has made us move strides here in the work we're doing. But also it's relevant in the context that we are innovating for. So here in Africa, if you look at how much of the national budget goes to healthcare, usually a meager. Look at the support that we have to get from donors, external funders. That usually actually comprises almost for some projects 100% to about if it's the lowest 50%, because of the mentality that some of our leaders here have as they approach healthcare. So you find that you don't have so much, like a lot that you have to work with, and yet the problem that you're dealing with is huge. So with MScan, I think how we have embodied this is around one. We understand that rural health facilities are most of them are off the grid, so you need something that actually is power efficient. They also don't have like good road network, so you also need something that is portable in a way that you can use, that you can easily maneuver to those locations. And so that sort of informed MScan as a product. And I think the success that we've had with all these 16 satellite facilities that we are deployed in have been a testament to frugality in that sense. So I would say us being low cost, being far efficient, being mobile, but also moving away from, I think the other last point I would want to hint on is we don't print, when a mother, is scanned and they see the sonogram, we don't print out the copy. We actually send it to them, via either WhatsApp or social media, can be, Instagram, whatever they choose, or email. And this in a way is also saving, what to use, for paper. So I would say, we are glad we are encompassing most of, the tenets of what frugality means.
Thank you very much. Thank you very much. I would like to listen another definition of what it means for you. I don't know, for example, Mahib, I'm sure that you have a nice definition of what it means for you, frugal innovation in healthcare.
Um, I think the frugality aspect of like what I consider to be frugal is trying to reduce the complexities on any kind of devices or any kind of things that we built. So not just in the baby warmer project, but in all of the projects that NIC kind of has been working on for the past few years, we try to keep the things as simple as possible. So as I have already mentioned about the need for having things up and running most of the time, that is achieved by keeping the overall mechanism or the engineering simple. So that is something that we have also integrated in the baby warmer device. And I think for any kind of biomedical device, I think that is also something to keep in mind of, trying to reduce the complexities so that it's easier for the next person who is trying to repair or like trying to fix your device to be as simple as possible for them also.
Thank you for your approach. And I would like to Ronald another what it means for you to have frugal innovation in healthcare. But I would like also that you kind of add some kind of the barriers in healthcare, because healthcare is not as other industries. It's a very regulated industry, so it's not easy to be frugal. So what it means to be frugal in healthcare innovation, and also what if you have any definition of challenge that you have faced for being frugal.
Well, thank you once again, Edu. And one thing that I would really love to highlight is when you look at the high income countries, they have solutions to literally every challenge, and their products are really great. So when you come now to the low middle income countries, we have the same challenges. So how can we be able to borrow the idea and the technology, the means that they are using out there in the high income countries to actually solve the same problem or even bigger than that, using the same principles but with something more less in complexity, less in but preserving the core principles of engineering. So the first thing that I really see is the borrowing and like getting the knowledge from the high income country. That's why you really say that frugal innovation is really like not even known in, let me say, Spain and things like that, because the challenges, the solutions to the challenges are really high end. But then flipwise to us, how can we get the same solutions to our challenges but with the same principles and maybe but with the same technology? You see, then so at the end of the day, we borrow the idea, implement the same, obtain the same idea and the same solution, and then it befits our population that we are in. So it's something that is customized for our environment, that where the challenges are contrastingly different. So, but then the problems that we find is for example, if you build your technology or design your medical equipment, the challenge that you will have is the quality of the product or and the service. For example, we in MRI find that though we have the system working, everything is okay. The quality, the image contrast, and the image details are not really as elaborate as maybe in the big field scanners. So one of the challenges is the quality of the product and the quality of the service. There is a reduction in that. And then sometimes you have to go into customizable or specialized equipment that actually befits your own system and your own challenge, and that really gets a bit tough. And but at the end of the day, once you break through and get the solution working, you have a green light. Let me just stop there in a nutshell.
Yes, for sure. The ones who make it up, they will be heroes for sure. And yeah, I think that all of you are heroes today, and we are ending up the time. I don't know if someone want to share any other reflection about frugality in healthcare, any barrier. I don't know, Mahib or Prosper, if you want to comment any other topic about frugality. Otherwise, we will also look at the chat if there are questions from the audience, or maybe we can jump with one last question before we end it up. So, how is it, Prosper, Mahib? Yeah, Mahib looks
Yeah, I
faster.
think I think we kind of I just wanted to mention about the since everyone is there in the healthcare in the biomedical scene. So one thing I wanted to kind of bring into the picture was in countries like Nepal, we don't really have a regulatory body. So this kind of it is a barrier for any kind of innovators to work on a biomedical device. So early on, when we were working on this project, we tried to learn on what are the requirements, how are the international standards around the baby warmer, like kind of drafted around. So we found out about the IEC standards, which were kind of the dictating documents on what the safety and the performance standards should be. We read through all of those documents and found out that there were more documents. So we spent a considerable amount of time in terms of understanding the overall certification process. So what we are at a point where we internally have spent a lot of resource and money in terms of the regulatory parts. We have the testing equipments. We also have the compliance documents, which are not cheap. So we have procured all of them, but the government doesn't really have a standard procedure to certify the product. So what we are eventually planning to do is to test the device in India, get a testing mark from there, and kind of work throughout the ISO 13485 medical manufacturing process. So in this way, we can like scale as the numbers increase. We can assure that the quality is also going to be up to the highest of standards. So just wanted to mention about that, and I'm sure other countries might have different kind of barriers, but in Nepal, I just wanted to point out this barrier that we have faced.
Great. Thank you. Thank you very much. So let's see if in the chat we have any extra questions. I don't know, Manu, if we have questions in the chat.
No, in the chat we don't have any questions, but then I have a question towards Mahib. Like you said, like you have I think manufactured I think more than 100 devices like all around Nepal, and like have you trained have you trained the people? You said like you train the physicians or the nurses to use them, and how do the training sessions?
So the training sessions are usually conducted just right after the installation. Our team has been to all of the 100 sites that we have installed the baby warmer. We go there personally. We have a public health researcher who takes care of the training part. She can connect with the nurses and the end users on a much better level than us engineers could. And we take them through the entire operation procedure about the device. What are the alarms? Where do you place the baby? Because some of the nurses have not used a baby warmer before. Some have used it, but it might have a different kind of functionality. So we have considered the usability factor, and we have kept only an automatic control mode. So the heat is regulated accordingly based on the sense temperature, a very basic method. But some of the nurses have been using a manual method. So they kind of ask us, okay, where's the manual mode? I've been a lot more comfortable using the manual mode. I don't know about the automatic mode, but we kind of tell them internationally it is kind of enforced upon or suggested to use an automatic mode because it's much more safer. So there are some things that in terms of their practice are not standard, which we have to teach them. And oftentimes it's a little bit harder than teaching someone who has no experience. So we take care of that. And as we have been training a lot of nurses throughout the years, we have got more experience. We have been able to conduct a very brief but a comprehensive, all-inclusive kind of hands-on on, okay, how do you do this? How do you do that? We kind of ask them later on. And we also have refresher trainings, as I mentioned, every 6 months and so that we know that they have been using it and they don't have any problems.
Amazing.
All right,
Thank
all
you.
right. Yeah, thank you for that.
Thank you. Yeah, but because I had the chance to be also in Uganda with Prosper and Scan, I know that they are also doing the trainings. They have a training platform for also train the nurses and the midwife how to use the dem scan. And it's a crucial part of any technological proposal that goes to a unserved population like the rural or anyone's, because the training becomes super important, because also the professionals there sometimes they are not used to these kind of devices. So the training part becomes sometimes even like the product part as important. So thank you, Manny, for these questions. And we are running out of time, so we are almost we are the time to finish. So I would like to just do a closing up of what we have seen today. And thank you very much for being here, all of you, all of the panelists that has collaborated with this initiative. And because we don't have any question in the chat, I will move just to the thank you for being here. Also, thank you to the Global Health Next Generation Network for participating and promoting this event. I'm Edu Soler coordinating Frugal for Health project, and today we have had the chance to listen frugal projects from Uganda, from Kenya, from Senegal, from Nepal. So thank you, Mahi, Prosper, Ronald, Faith, and Alpha for being here. It's a pleasure to have you on board, and it has been a pleasure to also film your initiative in our channel. And also this webinar will be posted in the YouTube channel for anybody who wants to know your story. Thank you all of you for your time, the attendance of this first webinar. It was also kind of a test of to see if this webinar was interesting for the community, and looking forward for other projects and other webinars that in the future. Goodbye, everyone.
Right. Thank you so much. Bye, guys.
Thank you all of
Take
you
care.
for your
Bye,
time.
everyone.
Bye.
Thank you.
Goodbye.
Bye.